Hello, and what we are going to be talking about is basically a hemifacial spasm. So the hemifacial spasm is a neuromuscular condition wherein, because of the compression of the facial nerve, what actually happens is you can see this kind of spasms on all the muscles of the facial expression which are supplied by the facial nerve. So our patient has been very kind that she's agreed to be on our video, and what she had was a hemifacial spasm which was involving all her orbicularis, her zygomaticus minor, major, and now in extensive conditions what actually happens is sometimes the platysma muscle also gets involved. You can see this kind of muscle spasms which you can kind of see the platysma pulling, and of course the DAO is also pulling her corner of the mouth. Now what I have done previously about a few weeks back is basically I have injected botulinum toxin into her orbicularis oculi area, and also I have hit on to her zygomaticus minor, major, and levator labis superioris alegnezi also. So this part of her upper face is now quite stable and she doesn't have spasm on this. Now in aggressive conditions you can see this kind of spasms which are basically caused because of the contraction into the platysma muscle. Now the platysma is actually a very wide, broad muscle in the neck area which starts actually from the fascia above the pec major and the clavicle here, and it's very superficial, comes and gets attached to the lower border of the mandible here, and sometimes it actually goes on to the corner of the mouth as well. So this normally many a times what we do is we inject botulinum toxin as an anti-aging injection technique wherein like we see the platysma bands. So what I will be doing here is basically injecting botulinum toxin for this kind of hemifacial spasms. Now if you see, she's quite okay now, but the spasms actually comes in when she starts talking or on movements. This spasm starts. You could have seen that earlier. Now what I am going to be doing here, as I said, now that it is stopped, so what I will do here is, this is my lower border of the mandible and I know my platysma gets inserted here, and sometimes it also comes here to this area. So what I will be doing is I will be injecting about 3 units here onto the lower border, 3 units here, and since it was very aggressive and she has some functions coming up, so I wanted the spasms not to come in. So I'll be injecting into this 3 points into the platysma which is getting inserted into the lower border here. Also what I will do is I will also inject a little bit into this area and a little bit into the DAO also. So this is going to take care of my spasms here, and apart from that आप ऐसे कर सकते हैं, तो थोड़ा स्ट्रेच कीजिए yeah. So these are my platysma bands. एक बार फिर से खींचिए. Yeah, these are my platysma bands. So what we normally prefer to do in as an anti-aging technique is basically we hit on to this platysmal bands. Yeah. So where you see these bands is actually where you need to be injecting so that you can actually relax the whole the muscle there. So in a normal anti-aging technique wherein like we will be injecting, so we ask the patient to stretch the mandible and then we inject onto the bands here. But then I'm just looking out for all the muscles which are getting into a spasm so that I can be injecting. आप खींचिए, स्ट्रेच कीजिए ऐसे, नहीं ये, yeah, okay. Okay, so if you see this is getting pulled here, and yeah, yes. And I think I'll be giving a little bit into the mentalis as well. So I'll hit on to the mentalis as well here. So mentalis, a little bit into the DOA, and I'll be giving 3 points of injection into the platysma and towards the corner also. And also I'll be hitting on to these bands which are actually pulling. Yeah. That should take care of the whole spasm there. Yeah, stretch कीजिए थोड़ा सा. Yeah. Okay. So what I have done here is I've already cleansed And now coming to the point, how much to inject? I would prefer, since it's very superficial, the injection should be very superficial here. Of course, this can be a little deeper, but these has to be superficial because it's a very superficial muscle. And what I will do is I will inject in this area about 3 units in this points. Mentalis again I will be doing a 3 units here. DAO here I will be doing about 2 units here, and here all the points I would be doing about 2 units. So what I'll be doing here, I have injected, I have loaded CX here, and my dilution is 2.5 cc into the 100 units. So one second, 3 units, 3 units, and 3 units in this area. So I'll be injecting about 3 units into the DAO as well. Okay, I'm sorry, the Mentalis, and about couple of units into the DOA. And so this part is done. Now what I will do is I will also inject about a couple of units into this platysma bands. So since I said this is a very superficial muscle, so we have to be superficial. So I've injected into these bands now. In similar way, I'll be injecting into this bands as well. And we have to wait for, as we all know, the rule of 3. The effect starts by the age, by 3 days, and the maximum effect we can expect in 3 weeks. And as we know, botulinum toxin lasts for about 3 to 4 months, and we should be looking at re-injecting into these areas into 3 to 4 months. Nerve decompression could be a surgical procedure, but that's again a very invasive procedure to take care of the spasm. So botulinum toxin is a very effective treatment modality for hemifacial spasms.